Member for New Westminster.
Well, speaking of value for money, Honourable Speaker, let's turn to health care. In February in this House, we asked about a health IT project, the Clinical and Systems Transformation Project, which has a whopping price tag of $842 million over 10 years. We had been hearing disturbing reports at the time that there was a major dispute between the government and the contractor, and we brought the minister proof in February that the 2015 startup date that had been planned had been scrapped and that nothing would be going live until at least 2016 or later. What did the health minister say in February? Quote, "I have full confidence in this project." Well, we now know that the project has gone completely off the rails. According to another leaked memo dated March 23rd, quote, "The health organizations and IBM have agreed to end the current contract." Can the minister tell this House how much money this government has spent on a project that has now completely collapsed?
Minister of Health.
Thank you, Honourable Speaker. The Clinical and Systems Transformation Project for the Lower Mainland is critical to ensure that we have improved patient safety, that we have improved quality of care, that we have a single patient record for patients throughout the Lower Mainland, whether they're dealing with Vancouver Coastal, Providence Healthcare, or the Provincial Health Services Authority. Madam Speaker, this IT transformation project is where the future of healthcare is. It is a large project. It has been challenging, no question. I don't know of any computer system anywhere that hasn't been a challenge to unveil, Honourable Speaker. But the fact is that IBM and the CST project team decided to part ways, but all of the work... Some marriages don't work out, Madam Speaker, but sometimes they produce great children. This marriage didn't work out. But the children are beautiful, Madam Speaker. In fact, those children will grow to become a great clinical and systems transformation project. Madam Speaker, this project is alive and well. I can assure the members opposite that this will result in better patient care for the citizens of the Lower Mainland. We will continue to work hard on this project to ensure that it is, in fact, successful.
Member for New Westminster on a supplemental.
Honourable Speaker, it is clear we have reached a point where the platitudes and the empty reassurances by this health minister just don't cut it. They have been warned time and time again that this project was at serious risk of going off the rails, and they chose to ignore it. And we're talking about health care dollars, Honourable Speaker. We're talking about $72 million that the government moved out of health care each year over several years to help to fund this project. Invaluable health care dollars, Honourable Speaker. They did this at a time when, according to the Seniors Advocate of British Columbia, frail seniors in BC desperately need more home support and rehab therapy in order to live independently in their homes for as long as they possibly can. Programs that this government refuses to fund the way they should be funding. So the government had an IT project that they knew or should have known was doomed to fail, yet they continued to pour more and more money into it. So what's the total figure, Honourable Speaker? Will the minister tell not just this House, will he tell the people of British Columbia how much healthcare money was put into a project that was doomed to fail from the start?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, we have doubled the healthcare budget since 2001 in the province of British Columbia. We are #1 in healthcare outcomes in Canada, #3 in the world. This This government knows how to deliver health care, Madam Speaker. A critical component of delivering health care today and into the future is having the proper electronic health records to ensure that patient records follow that patient wherever they may go. The proper clinical systems are in place for standardization. Madam Speaker, we have done some very good work on this project that will be preserved. I can assure this House that this project will continue. It will be successful, Madam Speaker. I have great confidence in the project board, and this project will complete it within the assigned budget to provide the very best service for the patients in the Lower Mainland.
Hear, hear.